So when I arrived at the day hospital at the Royal Free, the service covered North Camden, which is 100,000 people, about 15,000 people over the age of 65. And the day hospital was open for anyone in North Camden over that age. That was the definition of older then, over 65 years, with a psychological problem. It was not a day centre for older people, of which there were several, nor a day centre for people with dementia. It was specifically for psychological care. And that's where the person was not so ill that they had to be in hospital, but rather too unwell to be seen by their GP or a counsellor or any other single practitioner. And we worked as a team to support those older people who generally felt that life was not worth living, or who could not cope on their own or with their family because of their psychological distress. They would come to us, that was me, my junior doctor, our manager who was a nurse who also trained as a therapist, our art therapist, our occupational therapist, our psychologist, our two highly trained nurses. We were quite well resourced. And we had about 40 patients at the day hospital, and they would attend 2 to 3 days a week for morning and afternoon group sessions, plus a hearty meal, and then go home in the evening and stay home at weekends. Most of them were depressed, others were anxious. For some, this was yet another time when they were not able to cope anymore with life. Some had schizophrenia, some had bipolar disorder, some had alcohol problems. Many had been suicidal, and life was still up for grabs as far as they were concerned. Many had been to casualty or into hospital, having tried to kill themselves. All of them were very distressed. They could be living on their own, they could have family difficulties, they could be recently bereaved, they could have physical illnesses, financial problems, housing problems, all of it. Our aim was try to engage them, which at times was very difficult given the stigma of psychological ill health. We needed them to feel welcome, to trust us, and to attend. We then needed to really begin to understand what their problems were and give them belief about a future and time to think with us about what they were going to do in the future and to work through any changes in their lives. Alongside this, we discussed, and where needed, we prescribed psychiatric medication, and about 95% of them were on a regular psychiatric medication. We were able to liaise closely with their general practitioners about their physical health and see them with their families if they wanted us to, liaise with social services or courts depending upon their needs. And they could stay with us until they agreed with us that they were ready to move on, when they could then go back to just seeing their GP or to one of our community teams or to see me in outpatients. Some, unfortunately, would need a short stay in hospital, either for psychiatric or for physical problems, but we would then visit them on the ward and try to bring them back to the day hospital as quickly as possible, if they wanted to. Initially, the day hospital was in the grounds of Royal Free, but we were then moved to a beautiful purpose-built building called St Mary's House up on Hampstead Heath. The service and the staff won awards. But meanwhile, changes were occurring in the National Health Service. Psychiatry was moved out of acute trusts, so we left the Royal Free into separate mental health trusts. The internal market was arriving with primary care trusts and payment by results. Our trust became Camden Mental Health and Social Care Trust, and we were asked to extend our day hospital and therefore double our catchment area. This we agreed to do, but when we asked for extra resource, required really to continue to work in the way we were doing, none was given. We carried on a little distressed ourselves. Then we were merged with Islington and became Camden and Islington Foundation Trust, which in essence is a business. A foundation trust is a business set up to trade in the marketplace, which could sink or swim according to their finances. and we were asked to extend our service again, this time to include the whole of Islington, therefore doubling our catchment population yet again. Austerity had arrived and 20% efficiency savings were demanded of the NHS. We were given 2 extra nurses and then told to get on with working with these people, but in a different way. We also, at that point, lost our building. We were moved from this beautiful building to share a much smaller building in Camden Road, even though we're expected to cover 4 times the catchment area.